this morning we're treating an emergency patient. It is a fractured molar and it is eliciting severe pain. Patient hasn't slept well in the past 3 nights. We attempted to alleviate the problem with antibiotics, but the pain just continues to get worse. So we've decided to conduct an emergency extraction of the tooth, and we're placing growth factors that we derive from his own plasma to prevent dry socket or infections from taking place during the healing of the extraction site. In addition to that, we are routinely providing IV sedation as well as nitrous oxide sedation, which is what we're doing today. Okay, now we'll go ahead and degranulate the infection when you have the surgical curette. So not much to degranulate yet, which is good news. So this was more of an emergency related to pain. ¿Está bien? Ok. ¿Ya salió, ok? Ya. ¿Te dolió mucho? No? Okay, perfect. We'll be taking the growth factor proteins that we were able to produce from his own plasma by just drawing a few tubes of his own blood at the beginning of the procedure. So these growth factors basically contain proteins that send signals to the cells to regenerate the bone that was remaining after the extraction. So the most important aspect of these proteins at this point in time is that they will prevent a dry socket, which is an infection of the bone, from occurring, and that happens sometimes as a consequence of extraction, but we rarely get those complications because we use the patient's own growth factors. And we'll use a 3/0 chromic gut suture. We're using also a resorbable suture so as to not unnecessarily have to bring the patient back for suture removal in lieu of the non-resorbable, which is what we sometimes use to keep the growth factors intact. But this chromic gut suture will keep everything contained and it will dissolve over time, so he won't need to come back, thereby limiting his exposure. So we're done with the procedure. The patient tolerated the procedure extremely well. The nice thing about using nitrous oxide gas is that we can do same-day treatment in case the patient has had something to eat or drink this morning, which he had. So we decided to go with nitrous oxide instead of the IV sedation, which requires a certain level of fasting. So I think he's going to be able to sleep well tonight. He wasn't even aware when we took the tooth out. He's happy right now and looking forward to helping more people with their emergencies. Thank you.